Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. We can't believe it's been 2 years since the COVID-19 pandemic has been running. Since then, all the activities outside have been restricted, as well as learning activities. All the students, including the medical student, carried out all the entire learning process online from home. Many people say that online learning is less effective than offline learning. Especially for medical students, many activities can be done online, and many medical students feel many limitations in online learning. Maybe some of you are the medical student and feel related to this problem. You feel many limitations in online learning. Because of online learning, many medical students are worried about the quality of themselves. Furthermore, when they become a doctor in the future, when they someday become a doctor, if you are one of them, I think this is the right topic for you. This time, I would like to present the reason why online learning for medical students can lower the competence of the doctor in the future. I will highlight the three reasons. First, on the practical skill side. Then I will mention about the limited guidance from the lecturer, and after that I will explain about the student inability to see the real medical case, and finally I will summarize my presentation at the end. The first reason why online learning for medical students can lower the competence of doctor in the future is due to the practical limitation, as I mentioned before. For medical students, practical skill is one of the competencies that are really important. They are not only required to have a good thinking skill, but also required to have a good practical skill. Based on a survey in a journal released by BMD Medical Education, it is said that due to the online learning, medical students are missing a lot of important experience for early education, especially hands-on practical learning. Some practical activities are indeed more appropriate to be carried out directly in the laboratory, and activities is not possible to be carried out at home. Even some practical activities, some tools are only available in the laboratory, and it's not possible if the student have that tools at home. So yeah, it's proven that many practical activities that students can do remotely from home. Next, let me talk about the second reason. In the second reason, I will mention about the limited guidance from the lecturer. In online learning, students and teachers or maybe lecturer can meet face-to-face in the same room. They just communicate remotely by some platform like Zoom or Google Meet or Microsoft Teams. Therefore, teacher can control their student directly. Based on my personal experience, misconception between medical students and their lecturer often occur because of some communication barrier. For example, in a discussion group, there are often misunderstandings between the lecturer and the student. Now, let me move to the third reason. For medical students, seeing the case in a scenario is not enough. Students must know the real existence. Medical students have to see the real case in the field. Because of online learning, medical students will lose the experience of seeing direct case that can be felt by many medical students before. Mary T. Johnson, in her journal entitled Our Education, Our Concern, the Impact of Medical Student Education of COVID-19, said that due to the COVID-19, medical students have completely lost all the contact with patients. Since the COVID-19 pandemic, the meeting between student and patient is really limited. As a result of that, of course, many medical students can see the real case. In conclusion, Offline learning for medical students is really needed. It is proven that online learning is considered less effective for medical students. In medical education, there are many activities that cannot be carried out online. By online learning, medical students lose a lot of experience in learning. That's why many people say that online learning for medical students can lower the competence of the doctor in the future. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.